Hi, and welcome to the training on the Thrive Pathway Childcare Business Assessment. I'm Gary Romano, CEO of Civitas Strategies, and I'm going to be taking you through this today. It may be helpful to have the actual tool handy as we go through this. So don't hesitate to keep it at hand, maybe refer back to it. But let's get into the content today. So we're going to be talking about what makes a resilient childcare business. So before we talk about why we're assessing or how we're assessing, we're going to say why are we assessing these things. Then we're going to talk about how you actually perform the assessment. We're going to show you the assessment, go over the key questions, and then talk about how you chart next steps with the childcare business owner you're working with. So let's talk about some of these things that we found to be elements of a resilient childcare business. And these were actually built in two ways. So one way, we had back in May, a meeting with a number of leaders in family childcare throughout New Hampshire. So this included folks who are providing supports to those businesses, but also some of the business owners themselves. And what we talked about was what makes for a strong childcare business. We bumped those answers up against what we've seen nationally. And our firm works with childcare business owners across the nation. Right now, we are coaching the largest number of childcare businesses in the US. And what we found was there was a very high degree of alignment. So it's a nice way to check it. Not that New Hampshire can't be unique, excuse me, but it does show some alignment in what we're seeing. First and foremost, we see an obsession with cash flow. And we see obsession because it's the lifeblood of the organization, right? You can have the best budget in the world that shows by the end of the year you're going to make money. But if by June 30th, you don't have enough money to pay your bills because you're owed that money in July, August, and September, you could be out of business. So cash flow is absolutely critical. And along with that, we hear inventory as well. So, keeping an eye on not buying too much, but not buying too little. You don't want to be stuck without paper towels, but on the other hand, you don't want a whole garage filled with them and you're tying up your cash in paper towels. Maximizing revenue through diversified funding sources. So, what we've seen is that the most resilient childcare businesses are ones that have private pay, right? They have parents who just pay out of their own pocket. They have subsidy. They have the child and adult food care program. And it amazes me how many childcare businesses don't participate in this. It's really shocking because when you look at the way it's designed, there's money built into the program to help cover the administrative costs, the costs of running it. And you're typically feeding the kids anyway. So it's a sunk cost. It's what we call a cost that you're going to have to pay for regardless. So why not get money for it? And, in fact, a different state just a few weeks ago, I had a childcare business owner who was saying to me, well, they're entirely subsidy, but they stopped doing the child and adult care food program a few years ago and they don't remember why. And she was like, yeah, it's a really good idea. I don't know why we're not doing it. Our kids qualify. We also think about very simple business partnerships as well in this. In our work in Texas, one of the things we did was find ways for businesses through simple discounts. So in other words, a childcare business saying to a local business, look, you tell our employees about us and we'll waive our registration fee, or we'll put them at the top of the list for a wait list. Those kinds of relationships can really be mutually beneficial. The employees and the employer getting a benefit, and the childcare business owner having an easier time in recruiting families or making sure that they have families who quickly fill their slots. They have a culture of support, engagement, and quality. They're really focused on supporting their employees, supporting their families, engaging their employees, and also quality. One of the things we heard in New Hampshire and we've heard around the US is some of the strongest childcare businesses, regardless of the community they're in, don't necessarily fill all their slots because first and foremost, they want the parents to feel like this is a quality institution. And to do that, sometimes you need to be under capacity. And also that works with your employees because then they're not as stressed out. So I'm not saying everyone should be under capacity, but in some cases, that may be the best choice for some of these most resilient businesses we're seeing. Safety and communication is another one. When it comes to parents, they talk very specifically about safety, 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 which is an important lever, right? If you notice, we did mention quality, right? There's an educational aspect, but there's also this very clear element of safety. And you're going to hear about it again and again throughout these items. And communicating, not just communicating the safety, but communicating on a regular basis. Typically, that is daily communication, even if it's just something simple like, you know, Maria did this today. It was really exciting, but also on a weekly or monthly basis. So having a simple newsletter or an email update, maybe for all the preschool parents, or maybe it's just all the parents together, right? But having that communication on a regular basis is part of the safety because it makes parents feel comfortable. They know what's happening. There isn't this question about what's my kid doing all day. Adaptability, resilience, and professional development. So we see that these more resilient childcare businesses are the ones who are looking at the way the world is changing. They are focusing on adapting to it and typically doing that through professional development. So they're learning about some of the new technologies which might save them money, like AI, or they're getting ahead of the new requirements that the state is going to be coming down from, hypothetically, don't anyone start rumors. Um, that they're getting ahead of these things by getting professional development, by adapting rather than saying, I'm going to wait for the last possible moment, or I'm going to wait until my licensing rep comes and says, Gary, it's either now or never. I'm going to have to start fining you or pull your license. They get ahead of it. They also leverage community resources and partnerships. They find ways in the community to enhance their business. For example, in New Hampshire, when we had that meeting I mentioned, one of the childcare business owners mentioned how she would work with the local food pantry because a lot of her kids were eligible for their support. And that was good for the kids, right? They got extra food, they got to bring it home. But it also provides value for the parents that she's serving. So it helps her business, it also helps the children and their families, all positive things. Finally, technology integration and digital literacy. In some cases, this is a childcare management system. In most cases, it's something less than that. It's using a QR code so that parents can easily register to get an email or find out more about your business. It's about using Canva to make attractive handouts or a newsletter. It's about using Everlance or MileIQ to track your mileage so you can get that deduction, which increases how much you're making in a year. So they're using that technology first and foremost to save their time. And if they save time, they save money. And then it allows them to do some of those other things that we've been talking about. But again, it doesn't have to be, they're entirely wired to the internet. They have a CCMS doing everything for them. It could be just minimal pieces, but we see some element of technology being integrated into their business. So let's talk about how you use the assessment. You have the assessment in front of you, and this is in the assessment as well, but I want to go over it so you could hear it. First and foremost, we ask you to gather some financial data. There are links to some easy to use guides for creating a cash flow and a budget. Now, I know a lot of people say, well, my childcare business owners, they don't even know where to start. The tools you're using have literally they were developed by family childcare providers originally, and they have been used for years with family and center childcare providers, some of which have very low business acumen, and they've worked. So give it a shot. This also becomes a way for the business owner to start feeling ownership, not to overuse that word, on their data, on their business. So give them a shot. If they don't do it or they can't do it, you can still meet with them, right? And you can talk through the answer to some of these questions, but this gives them an opportunity to start learning from day one. Two, you're going to complete the assessment, and we're going to go through all the questions in a few minutes. you're going to see they're all pretty much yes or no questions. We did that on purpose to make the assessment easy and clear. You'll also notice there's no grade to it. This isn't about one childcare business owner feeling like they got an F and another one feeling like they got an A plus, right? This is about finding ways, identifying where the business owner needs help to build their business acumen. That's it. You're going to review those results with them. And again, you're going to do it in a way that says, even if it's question one where they were wrong, they got something not wrong, my apologies, where they answered no, right? That's okay, because it starts at the beginning. Do know, because this question has come up in some cases, maybe you don't want to execute the full assessment. Start with the first two or three questions. Start with the first question you get no to, because that's the one you should be working on. It's that simple, by the way, and we'll talk about this at the end, but literally the way it's designed, it's in a hierarchy. So if question one is yes, question two is yes, question three is no, start with question three, because that's the next most important question. So don't hesitate to even say, I'm going to keep asking questions until they get a no, and then we're going to pause on the assessment, and then we're going to work on that one thing, and then we're going to come back and say, okay, now let's go to question 4, 5, 6. Oh, 6, you need some help on? Let's work on that one. And that's part of what we're talking about here in this point 4 on your screen, is prioritizing some of those areas for improvement. And we've done it in the way that we've set up the questions. So the first no you get is the first thing you should be working on. And as part of that, you want to set goals. You want to create an action plan from it. You want to talk with the business owner about, now that we have a no, let's work on that. What are going to be some of the goals that we're going to set to help you realize that change in your business? So again, the questions, we're about to go through them. They're ordered by urgency and impact. Cash flow, going back to what we said earlier and what we saw about that obsession about cash flow, is number one, for example. Spoiled that one for you. And so that's the most important one. So that's the first one. And they go all the way through questions around growth, or all the way through to questions around growth, which are really important, but you can't grow if you don't know what your cash flow is, right? And keep in mind, these are designed to be binary. So they're yes, no questions, and that's to keep it as simple as possible for you and the childcare business owner. And by the way, if you're a childcare business owner, you can do this yourself. So don't hesitate, just because I'm mentioning how a coach might work with you on it, or a mentor, don't hesitate to execute this yourself as well. So let's talk about some of the questions. One, we want to ask what the most important financial goal they're pursuing is. Now, I know I said they were binary questions. This one isn't, right? The reason why is, so many times we found that childcare businesses, it almost becomes transactional with them, that they come in for help and the first thing is, oh, you don't have a cash flow, let's work on that, right? But there isn't necessarily an understanding of where they're trying to get in their life and in their business. And if you notice, I didn't say what's the most important business financial goal. Because with most home-based providers, and those of your home-based providers know this, your personal finances, your business finances are so closely interlocking that it's hard to fully separate them. And in some ways, you don't want, you want separate like business accounts and stuff, don't get me wrong. But in some ways, this is part of the benefit of having your own business, right? Is that your professional life is complementing your personal life. So you want to think about, what is that most important financial goal, because that may temper some of the answers. So for example, later on, we're going to talk a little bit about taxes on one of the questions. If they're trying to save to buy a home, or they're trying to, let's say, get a loan for their business, right? Maybe they want to become a center. Not that that's the goal that everyone should have who's in family care, but I'm just saying as an example. In those cases, there are different things they may want to do with their taxes than if they say, I'm 3 years from retirement and I just want to maximize as much money as I can. So we want to start by asking, what is that one big goal that you're trying to do, whether it's your personal life or your professional life? Then we want to ask about those questions around budget and cash flow. Do they have a monthly budget or longer? Do they have a cash flow forecast for 6 months? Do they know how they should guide their decisions, right? Is it a report that we've seen this before? The accountant sends over the cash flow monthly, but they don't know what it means. So it might be they have the tools or they have the information, but they don't know how to make it a tool for their work. They don't know how to use it. Do they have a system for accounting, payroll, and general record keeping in a business bank account? Do they have that basic infrastructure that's going to help them have the information they need, not only for their accountant, but for their taxes and everything else they do? Are they consistently paying themselves, right? Using a documented method. So, yes, most family childcare providers are sole proprietors. They don't get W-2 income. But once they get that cash flow down, they should be able to know how much they can pay themselves monthly. And maybe it varies a little bit, right? Maybe one month they're able to get out a little bit more for themselves, right? Maybe one month they have to take a little less, but in general, they should be able to get it and pull that money out. I mean, I think about a family childcare provider who I met very early in my work who had said, I said to her, when do you pay yourself? And she says, I wait until the bank account, the checking account gets big enough where I feel comfortable. And it takes a lot of money to do that. Well, that means she's not really getting the fruits of her labor on a regular basis, and she should. Now, she shouldn't do it. I'm not saying pay yourself, even if your cash flow says you can't, right? But what I'm saying is once you get that cash flow down, are you paying yourself? What are your revenues by category? Again, this goes to what we talked about, that braided funding. Do they have private pay, subsidy, CACFP funding, or can they explain why they can't accept them, right? Are there grant revenues that are included that are going to be sunsetting soon? Do they have to prepare to be getting off of some public funding and be ready for that? Did they update their pricing in the past year? And is it based on existing market rates? That doesn't mean that you have to hire some big marketing firm to say, what are all the prices in New Hampshire? Right? This is as simple as finding out what the 3 or 4 providers in your community are charging. Um, and so think about those things, and how you're setting your prices. I mean, one of the things that I find very troubling is in all the areas of small business that I work with, childcare is the only one where they proudly say, we haven't raised prices since before the pandemic. We've gone through one of the greatest periods of inflation our country has experienced. You should be raising your prices. It's only fair. And by the way, and the materials that will help you with your prices explain this, we haven't seen parents across the country. We haven't heard of parents complaining when that price gets raised. They understand because they want the care, they want quality care. Are they confident in their tax preparation? If there is tax education available in your area, would they like it reviewed, right? To see if there are ways that they could get additional money or have their risk reduced. What we found in tax education work is that on average, we're seeing a savings of $7,603 per provider. That's huge. It's a 21% increase. In that data set, that's a 21% increase in their revenue overall. So there are some opportunities there because of unfortunately poor tax preparation that childcare providers and other small businesses receive, that they're losing money. This is a way to get cash in the door. Do they have an emergency fund or reserve? What's their debt to annual revenue? If the debt is 30% or more to revenue, do they have a plan for paying it down? Debt could be huge. We're seeing it especially with the EIDL grant, as those, or I'm sorry, grant loan, as those are coming due. We're seeing that loan really put some stress on the business. How are they doing that? Are they paying their quarterly estimated taxes? We see a lot of childcare businesses who wait till the last possible minute. They put their taxes in and they go, oh my gosh, Gary, my tax bill is huge. What could I have done? Part of it is paying it along the way. Not only does it prepare you for tax time, but if you don't pay enough, you get penalties. And who wants to just lose money? Are there home improvements they need to maintain or obtain licensing, right? If they're a startup, this could be about getting licensing. If they're already an existing business, could be maintaining licensing. Do they have a plan to get those money, to get the money for those home improvements? Do they have a liability insurance, homeowners coverage, or facility coverage in any way? Because that's important protection. So is a family agreement and contract, employee agreement, handbooks, policies, and procedures that are updated regularly. And do they communicate regularly with their families, right? Remember, we talked about the power of communication. But also these things are really important. I mean, I had a childcare provider end of last week who had contacted me, and she was in a dispute with a family, and she said, "Can I keep the security?" And I said, "Well, it really depends. I'm not hearing you say you have a family agreement or contract. You don't really have policies in place. In other words, it's hard to go to court and say, Your Honor, we deserve this money when there's nothing in writing saying, well, Your Honor, I told Ms. Jacobs the rules were A, B, and C, and she didn't follow the rules, as you can see, therefore the money is mine." See the difference? And it's an important one, especially when not only with money issues, but if there's an accident or something, these things set the rules for you. Do you have an emergency plan? Do you have a plan? By emergency plan, we mean like, if gosh forbid there's a fire, everyone meets across the street at this building, not only for the sake of you and any employees you have, but also for the families. Again, remember we said it's about safety, them knowing where the kids are going to be. I know that in one child care facility that we had our children in, our older one, when he was little, like I always knew exactly where they would be in an emergency. And if there was any indication, parent called and said, oh, they had to leave the building, I knew exactly where they would be. And a succession plan. And keep in mind, a succession plan isn't just, I'm getting older, I plan to retire in a year, what am I going to do with the business? It's also unforeseen circumstances. It's I get ill suddenly and my spouse needs to jump in and help pay the bills. Do they have all of the information they need to get those bills paid? Do they have the passwords? Do they know about this or that? Are you having staff turnover, or do you fear it's going to happen? Are you understaffed or anticipate hiring in 12 months? Then we're going to want to talk to you about some best practices around hiring. Um, do you want, or do you want for your staff retirement benefits? Again, a key point. One of the things that we see when it comes to family care providers in particular is when they leave, it's almost the same issue that you have with employees and retention. So when we approach keeping family care providers in the industry or getting more in, we think about it as recruitment of an employee in a way. Not that they're working for somebody, but they're making the same comparisons, right? They're thinking about, well, if I had a W-2 job, I'd get benefits, right? Versus how can I get benefits and keep all the things I love about having my own business? So retirement in particular is one we hear a lot about. That's absolutely critical, not only for older business owners, but also the young ones who are looking at those W-2 jobs and saying, is it this or is it that? Are you participating in business coaching or attending one operational training or conference every 6 months? Remember that? Getting ahead of things, right? Knowing what's happening, what's new, how do you adapt? Can you articulate your target audience, right? Who are you selling to? How are you selling to them? And the benefits. Do you have enrollment goals, right? Maybe this isn't a problem for you right now because you're full, but it's good to be ready if the market changes. Do they regularly ask enrolled families and staff to refer other families? Is there an incentive in place, right? Referrals, the easiest way to a sale. Shortest path to a sale is always somebody who knows the job you do and how good it is, or like an employee has a stake in the survival of your business. Shortest path to a sale, right? Sometimes we think, oh, it's got to be social. It's got to be 1,000 flyers going out to every supermarket in the neighborhood. Fastest way to do it, we've seen this again and again, ask your families, ask your staff, and make sure they're happy, of course. Do you have daily communications with families in a monthly newsletter or email, right? Are you having those communications? Do you have a basic website and at least one social media account? I know I said social media is not necessarily the number one way to sell, but it can also be helpful. Plus, goes to that communications piece. It's another way that you help communicate with families and with the community. Are using at least two technologies. Now, maybe that's the CCMS as we talked about, but it could be a bookkeeping system like FreshBooks or QuickBooks. It could be apps, as I mentioned, like Everlance, Canva. We're just looking, are you helping to leverage your time with technology? Doesn't have to be the biggest technology, but are you doing it? And then finally, optional. And I say optional because small is beautiful, right? If you want to, I was talking in Nebraska this past weekend. I was doing a conference and I'm sorry, the weekend before. not that you know it's recorded, right? Um, about her, and she was saying that she was thinking about moving from a family care business to a center. And she said, the more I thought about it, the more I said, I love being a family care provider. I don't want to be a center. Just doesn't appeal to me. I could do it. And I was talking to her about that's wonderful. Small is beautiful. If you want to stay a family care provider, there's no shame in that. And I think sometimes in the industry, we almost create a hierarchy where we say, well, if you're a really good family care provider, then why aren't you a center? You may not be a center because you just don't want to be a center. That's okay. But if you do want to grow, if you want to find out how maybe, like we're seeing in some states, family care providers saying, I'm going to convert this home, into like a mini center and I'm going to open a second home-based care and I'm going to move there or vice versa. Those are things that we can talk about. But again, and there's some resources that are, attached to the assessment. But the idea is this optional? It is optional. And, is it something they want to pursue? So now what do? You have all your answers. One, prioritize the goals. Remember that first no you hit in those questions, that's the first one you work on. Develop an action plan, right? We're going to go after this one. Here's how we're going to go after it together. Provide ongoing support and resources. Help them get there. Celebrate the success and adjust as needed. What we mean by that is every time one of those no's goes to a yes, you'd be like, look, you've gone and you've now, jumped 4 of these hurdles. That's amazing, right? Because this is not easy. Because remember, they're balancing their family, they're balancing their business. They have so many things going on in their lives. And the fact that they're being able to improve their business on top of it is tremendous. At the same time, life happens. So you may need to adjust some of those goals. There may be cases where you say, we have to go back to one because now circumstances have changed and you're telling me it's not the same way it was. Or maybe they need a couple extra weeks on a goal because something has happened in their life, but get them back on track. Don't let them just rest on their laurels. And that's where you have to encourage continuous learning and support. Even if they get through all those questions, they're all yeses. Encourage them to take the assessment at least once a year. Things change, right? And they want to keep up on it. So what I'm going to leave you is this. I'm going to thank you for your time, right? But I also want you to know if you have questions about the assessment, you can reach out to us. You can see the information here. For those of you who are familiar with Tom Copeland, who is a legend in the field of family childcare business, a couple of years ago when he retired, we took over his website. It's a great source of information on how to improve your business. That information is there, as well as our Facebook, which also has information on it as well to help you. Take care.